Nearly 180,000 Americans have died from coronavirus, and we're still averaging more than 1,000 fatalities every day. The U.S. also has nearly 6 million cases, and the numbers, they're going up by about 40,000 again every day. Even though the virus showing no signs of petering out, the Centers for Disease Control just abruptly revised its guidance, raising the bar on who in fact should get tested. CDC now saying people without symptoms don't need a test, even if they've been in close contact with an infected person. So why the sudden change? Good question. Multiple reports are now saying that top Trump officials, they pressured the CDC to make those changes. And by the way, the president, he's been complaining about testing for months, saying we do too much of it. He's the only one who feels that way, and his people now are interfering with the CDC reportedly on testing, so that should come as no surprise. This all comes on the heels of the FDA Commissioner Stephen Hahn having to apologize for inflating numbers showing the benefits of plasma treatment that the president also lobbied for. That also came just 36 hours after Dr. Hahn stood near the president for a so-called historic announcement about that very treatment. The president has even said that there's a deep state inside the FDA slowing down treatments and vaccines for political reasons, all, of course, without any evidence. Now, enough of the politics. Let's instead look at the human toll that this virus is taking. And for that, let's focus on the city of Houston, Houston that has been particularly hard hit by COVID lately and now may have to deal with a hurricane bearing down. The Houston region is approaching 150,000 cases of COVID and 2,700 people. They've already died from the virus. But one key metric is on its way down, and I'm talking about the city's positive test rate. It hit a peak of nearly 20%, a number that health experts say is alarming, but now, thankfully, that number's falling. This chart shows how the curve is heading in the right direction, pointing down, but the virus is still taking its toll on countless families. The New York Times, they got exclusive access to the ICU at Houston Methodist Hospital, and it documented some emotional stories, including that of Ivan Sanchez, an Army reservist who needed a ventilator to survive.
My brother's very loving. He's very spiritual. We grew up together in Houston. When we moved here in 2001, we're brothers from a single-parent home.
Okay, and do you have any questions? I don't know.
Over the years, we kind of grew apart, but I like to think that we would have gotten closer. I'd let him know that I'm sorry. Sometimes I'm not the nicest brother, and hopefully we can grow from there and become closer. I'm just hoping that he recovers. Every day I pray. So does my mom.
Then there's Ana Flores. Both she and her husband Domingo, they were admitted to the hospital within hours of each other, and Ana had to be put onto a ventilator.
My wife, and it's not because she's my wife, but I've never met a woman that can get along with anybody.
Miss Flores, Ana.
We were high school sweethearts. We both went to our senior proms together. We got married and we have 3 kids. Hopefully we'll come out of this.
Earlier today, Andrew spoke with one of the New York Times reporters who documented that story, Sheri Fink, a correspondent for the paper, and she won a Pulitzer Prize for reporting on Ebola back in 2015.
Sheri, in the setup, we showed some clips about Ivan Sanchez and Ana Flores, who were COVID patients in the ICU in Houston, both of whom needed ventilators. Do you have any updates on how they're doing?
Yes, I was in touch with Ivan's mom today, and he has gotten out of the hospital. He's at a long-term care facility, still on a ventilator, still working. He's going to need a lot of rehab. This is a long haul. And the same with Ana. She's actually home, which is wonderful with her family. But there's also quite a bit of recovery that still needs to happen. And that's what we see with when you are critically ill with COVID. It can really take a long time to get better.
Take all the good news we can get. Throughout all of the time that you've spent in ICU units, as you've been reporting, what are some of the moments and images that stand out to you? What are the memories that jump to mind when you first think back on that?
I mean, so many stories, and we just talked about some of them, but also really what sticks out to me are the health workers. So it's just incredible that they go to work every day, that in this particular ICU and in many ICUs where there's been a surge of patients, a surge of cases, the staff say that, we're used to dealing with life and death, but this is the most that we've ever seen in terms of very critically ill patients all at once. Very often, like we just talked about, many weeks to see if somebody will even survive, and that's incredibly hard. Plus, it's their safety on the line. So I think that is really what sticks with me, is just this incredible respect for the people who are in those intensive care units working and seeing the suffering, and also having the weight of those lives, the responsibility to save those lives in their hands. And they're just the most amazing people, coming to work every day with a positive attitude, with hope, even sometimes through tears.
We're now 5-6 months into this pandemic. Over that time and over the course of your reporting, have you seen a change in the patients who are being treated? Age, ethnicity, socioeconomic status, anything like that you've noticed, trends that might provide some insight into who's winding up on the victim side of COVID?
So what was really striking in Texas, and Texas, of course, has a large Hispanic population, but it was a really disproportionate representation of people who identified as Hispanic in this intensive care unit. And that is a pattern that we're seeing demographically across the country, that minorities in particular have been harder hit than other populations in the country. And that was one thing we wanted to show here. It was really striking. One day we were in the intensive care unit speaking with a Mexican-American nurse who said, they look like my mom, they look like my sister, they look like my aunt. And she had, every weekend she came to work, she worked on the weekends, she had for weeks and weeks and weeks only had Hispanic patients. And we looked at the census, and it was the majority, a large majority of patients were Hispanic on that unit. And that's why we did one project where we really spent many weeks in the ICU trying to learn the stories of those families, those patients, who they were before they became critically ill, to try to give a sense. It's one thing to hear that statistic, but it's another thing to stand in a hallway, room after room after room, and every single patient is Hispanic.
I want to take you from the ICU to the headlines, if I could. I'm sure you're aware of the reports from CNN that the Trump administration pressured the CDC to change guidelines on testing. We've had reports that the FDA misrepresented its blood plasma data. I'm not going to ask you to jump in on the politics here, but based on your conversations with doctors and other medical experts, if there's a sense that politics begins to interfere with the science around COVID, what are you hearing from them that the potential impacts could be, potential worries?
The doctors I'm speaking with, they say that, when there are controversies or a sense that politics gets in the way, then it interferes with people's trust in science, trust in the data. What does it show? What doesn't it show? It can be, as confusing enough to begin with. This is a new disease. We're hearing new things all the time. We should expect that, because studies are coming out and we're learning more and more. That is not surprising, but the political element of this, I think, does impact people's trust depending on their politics. And that's really unfortunate. We just need to follow science. So they're saying this does have promise, but it's not fully proven yet. And they do worry about the effect of overselling it in a press conference and what that could do.
Finally, Sheri, we got our first reports of reinfections. Somebody who had COVID, got it, got better, and then got it again. Most people have been assuming that there's some level of immunity after people recover. How much of the response, both in terms of the governmental and the medical response, has been based on the hope that immunity would exist after somebody recovers? And if there is no immunity or a limited one, what risks does that pose to the response?
Well, I think that the scientists have been very careful all along to say, put your mask on, you recovered from COVID, but don't assume that you can't get it again. And interestingly, this is the first documented case, a really well-documented case of somebody apparently getting it again, without symptoms, by the way. as far as I last heard. So the scientists who I've spoken with or heard from who are discussing this are saying this is something that we expected could happen, and that it will be very important to see how long that immunity lasts, because with other types of, or other examples of this type of virus, that immunity or the antibody response, the immune response that the body makes may not last forever. And so this is very important to keep tracking it. I don't think, though, that it changes much in terms of the guidance, because nobody was being told once you have COVID that you have a free hall pass. Everybody was being told to observe the same precautions as everybody else. Where it could have an impact, of course, is when we look at vaccines, and it will be very important to see if we find a vaccine, or if some of the vaccines, the many vaccines that are being tested, that there's so much hope in, if they do have an effect, which scientists are very hopeful, of course, that will be important to track. How long will that effect last?
Sheri Fink is a reporter with the New York Times who has been taking us inside COVID ICU units. Sheri, thank you for that reporting. Thank you for a few minutes today.
Nice to be with you.
Up next, as you mentioned, Houston obviously dealing with COVID and also bracing for Hurricane Laura. We've got the very latest on the powerful storm as it approaches the coast of Texas and Louisiana.